continue with this nonsense. I have no hospital. I've never owned even a dispensary. I've never owned even a dispensary.
We have closed your hospitals.
You, Nyikal, you are not living by your funds. You are living by borrowed values. I have no hospital and we will not allow you. You have a conflict of it. You have closed your border. We will not allow a hospital. I have no hospital. We have anywhere. Everybody knows. That is the strategy you use to try and hide. You need to answer a question. Charge me. Charge me. You cannot be intimidating members. We are not your children. Who are you?
Let me take this.
No, we will not allow you. Just because you are the president's friend, we will not allow. You are the thief. You are stealing from chair. I'm not a thief. You and your friends are stealing from chair.
We have closed your office.
Where? I don't own a hospital.
And if possible, we will charge you in a court of law.
You can charge me. You can charge. I don't own a hospital. You are the people stealing from Shah. You and your friends. Bring your people. You are going to expose 12 because the company you are using to steal from Shah.
Chair, Honorable Kibagendi, we are dealing with this.
He's the one who should behave himself.
He's the one who should behave himself. We'll ask you, you made your point. Leave it there, let the chairman proceed.
You proceed, don't allow him to chair this meeting.
I am chairing this meeting, Honorable Kibagendi.
You are intimidated by this man.
I'm not intimidated. So let this exchange not between me and you.
We can actually ask you to leave.
I can actually leave.
It's okay.
I can actually leave.
It's okay.
You can't live by borrowed values on the Nyikal.
You should not be this committee because of conflict of interest. You should not be this committee. And we'll write to the speaker.
You write to the.
We will write to the speaker.
Produce evidence that I own a hospital. You are the one who should not be in this ministry. Your company is stealing from Shah.
We will write to the speaker. You should not be in the health committee because of conflict of interest.
Honorable Kibagendi out.
You cannot be in this committee.
Escort the Honorable Kibagendi out.
Yes.
And you are living the borrowed values.
Order, Chair.
Now, Honorable Cynthia,
no quorum.
let us proceed.
Honorable Chair, you know, the shouting match has been perpetrated by Honorable Kibagendi and the CS. It is utterly unfair for you to send Honorable Kibagendi out and have the CS stay here. Because there were the two of them. It was a shouting match between two people. It is unfair for you to send one member and leave the other party on Chache. You cannot do that. It is unfair.
Let's take the next step on that one.
No one.
Let's take the next step.
Nonsense you're bringing to this country.
Honorable Kibagendi, that's fine.
You should not be this. Where unaibia?
Waziri, proceed and read your answers, and now do not interact directly with any other member.
Who are you? You think you can?
Chairman, we will write to the speaker. This gentleman should not be in this committee because of conflict of interest.
Let me take this. It is not in your place on how this meeting is conducted.
Thank you, Chair.
Now, go and read what you have allowed you to read. Do not make any comments or any direction of any nature.
Thank you, Chair. We will tell the people of Kenya what is right.
Proceed.
But Chair, I agree with you.
Proceed.
Again, is the Member of Parliament for Kitutu Chache South Constituency, but also a member of the Health Committee. Good morning.
Good morning.
Kulienda aje?
Wapi?
Niliona ulichapwa bana.
Mimi hakuna mtu anaezana na mimi. Hawawezani na mimi.
What happened?
You want me to explain here? Yeah, we were at a funeral and people were chanting one term, the Member of Parliament there, because he's a sycophant of the system and the President did not like it, that I was probably pouring fuel into the fire. So he tried to grab the mic from me and tried to throw me off stage, and because of my fitness, I managed to stop him from pushing me down and didn't let the mic off my hand. Yeah, but of course the media had to call it a fight. We never really got to fight because had we fought, he is not as fit as I am.
Really?
Yeah, he may be huge, but it's a lot of fat. So we...
Oof, okay, we can go there because, I mean, we want to talk about health. I don't think we want to go into that direction.
Yeah.
But really, I don't know, Mheshimiwa Kibagendi, it didn't look good. Really,
yeah, it didn't look good.
I don't know what responsibility you take as a leader.
Genuinely, it didn't look good. In terms of responsibility, there's absolutely no way I take responsibility because I was saying what I say every day, everywhere. He was uncomfortable with it. He was the MC for the day. He ought to have let me say whatever I was saying and probably have a rejoinder. But because he knew the masses there could not have listened to him after I spoke, it has happened before. So he thought the best way to impress his boss was to grab the mic from me.
Anyway, so he's not here to explain to us.
One day, if you can call both of us here.
Yeah.
To...
On the promise that you not go for each other's mics.
These ones are more, you know.
Okay, Mheshimiwa Kibagendi, as NHF board was existing, there's also a new board of the Social Health Authority. I think it was led by, remember his name, Dr. Olweni. He was leading that board.
Yes.
And you are the health committee still.
Yeah.
And you're oversighting all these agencies. Mm-hmm. What was happening during that time?
First, I would like to state categorically that SHA is not a reform. SHA is a scam. It's a scam in the sense that if it was indeed a reform, the implementation would have taken a bit of time. The rushed implementation was for those who are behind SHA to hurriedly start earning from this particular scheme. So when we were working on the laws around healthcare, the SHA, the Chief Primary Healthcare and Emergency and Critical Care, when we were the bills, and I think that is one of the reasons why Dr. Nyikal is not here today. Dr. Nyikal, you know, in his heart, understands that this is an unfortunate scheme to defraud Kenyans. So it becomes very hard for him to defend this. Antony Kibagendi and Dr. Nyikal refused to sign the reports that we used to do that time. And we stood in Parliament and said, 1, 2, 3, there is no way we can be able to sign this report because we said this and the other have to be removed from that bill. And I want to state here that
you're saying there were reports to reject the bill?
Not to reject the reports that we kept churning out that were working towards creating the laws around SHA and Chief and all this. Every stage, we were involved at every stage, and we would give our resolutions and our input. And the most important thing in a healthcare insurance is what we call, number one, the claims management and approvals. You cannot outsource the core mandate of this authority to private entities. That one we refused. And I'm happy to see that my chairman is walking into the studio because it is one of the things Antony Kibagendi and Dr. Nyikal vehemently refused to accept. The outsourcing of the core mandate of this authority. Whereby, when now they came up, these individuals, the schemers who want to defraud Kenyans of their hard-earned money, came up with this company called Convergence. And I want to be very clear. I've been saying this. It is associated with one of the cabinet ministers. And then Apiero, that was hurriedly registered in Dubai in the year 2024. And again, in May of 2023, late in Dubai, and quickly in 2024 in Kenya, for them to be able to be ready for the implementation that was starting in the month of October of 2024. And this Appiero is again associated with an advisor of the president in State House. You see, that is a conflict of interest. That is one. Number two, universal healthcare coverage has 3 dimensions.
Yeah.
One is on financial risk protection. You realize today, the out-of-pocket expenditure by the users is higher than it was during NHIF.
Correct.
Do you have data to support that?
Yeah. Yes, it is obvious.
Yeah.
It is just common sense.
No.
Number two,
You have data to support that. That's
covering the population universally is a mirage. Because they keep telling us 25 million people are registered with SHA. But for you to be taken care of by SHA, you have to be paid up. Yeah. And what are the amounts that people are paying? And why are we pushing Kenyans to pay for the whole year?
Okay.
Particularly Kenyans that cannot afford.
Those are important questions.
Number 3 is on range of services or benefits. The benefits are inferior to what NHIF used to give. We have to be practical in this. You know, some people look at me and think I'm just doing politics. I'm being very practical and pragmatic because these are things that I have studied and done a lot of research around. So we really need to first ask the hard questions. Right. Why did we rush? Number 2, when Honorable Nakumicha came to seek funding for the system, initially they wanted about 5 billion shillings. After a few weeks, they increased it to about 10 billion, and then they went silent. The next thing is 104 billion.
Sam, we have meat and unga on the table, but people are waiting to eat. But what sometimes we politicians say, we have put the money, go and eat. The meat and the unga will not change into food on the table.
Just to be cooked.
So me, why I keep saying I'm optimistic, let's see if we can work with the ministry to cook the food.
Okay. I'll get to you, Gilbert.
I'm not optimistic like my senior is. While I appreciate his wisdom, by the way, Sam, I'm impressed with the panel you've brought here today. One, you know, Dr. Nyikal is the encyclopedia of the Ministry of Health in this country. Why? He has been trained in this country, served from the lowest level to the PS level, to the health committee, and now as a chair of the health committee. Number 2, if SHA was genuine from the start, Gilbert Osoro would be the CEO of SHA.
I don't think so.
That is the truth.
Did he
not because he's my tribesmate, not because he comes from my constituency, but because the machinations in there is about rewards for friends and relatives. That is why every day, listen, Sam. That is why every day they will send Gilbert to defend SHA because he understands everything. They'll send Gilbert to go to India. You go to India today, the only person they know is Gilbert. Facilities in Kenya, they'll tell you the person who understands this thing is Gilbert. But when he was in NHIF, he acted for almost 9 years. Today, I'm sorry to tell you, we may not know what position Gilbert holds in NHI, in SHA. Now, on to why I'm not optimistic.
Sorry, I'm not taking the mic away from you.
I'm not being unfair.
Mheshimiwa Kibagendi,
yes.
Dr. Mwangangi applied and got that job competitively. Gilbert, I don't know whether he applied. And
now, what I'm trying to tell you is...
He didn't apply.
You know me, I'm being realistic. I'm being practical.
You just said he didn't apply, but carry on.
And when I say this is because, let me ask you, who in SHA can articulate issues around SHA like Gilbert has done today and like he has done in the past? Nobody. Because friends and relations have been given those opportunities. Now, on to the next. Why I'm not optimistic. The politics around SHA. Number 1, the CS, Honorable Duale, does politics with this thing.
That I agree.
He is not what Honorable Nyikal has said here about the issues that we have and why we need to come together. What Duale does comes to camera, threatens people, threatens facilities, threatens politicians. Kibagendi is making noise because he owns a hospital.
Yeah.
I don't own a hospital.
Are you sure?
Yeah, I don't. I don't even know how to hold a syringe. Yeah? So, and that is why I consistently say, because, number one, of his complacency, him and the chair of SHA, they need to actually resign. Why? They have been associated, some with facilities, and some with this Apiero and convergence. That is what we are saying. Now, we should not confine ourselves on matters to do with healthcare reform on SHA. You know, healthcare financing law, it needs to be looked at, yeah? And the biggest cost in healthcare financing is the healthcare workers. Are they motivated enough to even provide the service? You know, we have consistently confined ourselves to SHA. Healthcare is labor intensive. What is the ministry doing to ensure we have adequate personnel, motivated personnel? Do we have the healthcare products and technologies? This is where agencies like SHA come in. You find again that the people in the ministry are again conflicted from the top, whereby,
what do we do?
Listen, that is where we are saying.
Yeah.
Number one, Duale must resign. He is conflicted from manufacturing to provision of these systems. And I want to ask you, my brother here says SHA is a state-of-the-art system. A state-of-the-art system that does not work. It doesn't work. For you to be able to flag out fraud. Listen to me, please, listen. Yeah. For you to be able to flag out a fraud, that system cannot.
It can't.
You have to call.
It can't.
It has to be manual.
Yeah.
Okay.
Look, listen, Kitutu, a little. If somebody is upcoding, somebody steps into the theater for, let's say, appendicitis. Yeah? Appendicitis, probably 60,000 shillings is what the hospital will make. And then the hospital decides, let's do this. Let's just push it to a knee or hip replacement. Yeah? The system will not know. It is through calling some Gituku that can only be established. When they say state-of-the-art system, the most sophisticated systems we have in this country are in the military, are with Safaricom, are with KRA, even IFMIS. Let me tell you, no system in this country costs more than 50 billion Kenya shillings, however sophisticated it is. This is theft. 104 billion Kenya shillings is theft. And guess what? We are getting this system from Apiero and Convergence that have never provided such a magnitude of a system. They've not even provided any kind of system anywhere.
That's true.
Anywhere in the world. Now, but you go on to tell us this is such a state-of-the-art system. Genuinely, why are we lying to Kenyans?
All right.
Like I said from the start, this is a scam. While I agree with Honorable Nyikal that now we have this problem.
Yes.
How do we make it work? That is what we need to work. Instead of Duale harassing people and abusing people, he needs to step down so that we have more sober people who can come together and push for this thing to actually work.
All right, I hear you.